This is a guide for care home workers to take you step by step through the process of telling relatives by telephone about the death of a resident from COVID-19. There are 7 steps and advice if the resident had grandchildren or other important relationships with children. This video is supported by 2 written guides, one for you as a care home worker and one for the relative to help them tell any children in the family. First, prepare yourself. Take a few slow, deep breaths to help you focus. Check the resident's information. What name were they known as? Do you know if they had children, grandchildren, or a partner? If you can, relatives have found it helpful to know the name of who was with their loved one towards the end of their life. Check the latest protocol for when a resident has died and what bereavement support is available. You could practice what you're going to say with a colleague. Find a space where you won't be interrupted. Switch off your mobile phone and use a landline to make the call. Step 2. Starting the phone call. If the person does not answer the phone, do not leave a voicemail. If they do answer, introduce yourself by name. Clearly explain where you're calling from, for instance, which care home, and establish who you're speaking to. Check that they can talk privately. Speak slowly. Counting to 3 in your head can help slow you down, particularly if you're feeling nervous. If the person is very distressed, they may ask straight away if their relative has died, but don't rush into it. Just continue to the next step, setting the scene, which prepares the person for the news. Set the context for the call. I'm calling to talk about John. What have you been told so far about his condition? Is there anyone else you want to be in on the call? Step 4. Sharing the news. Talk slowly and honestly. Avoid euphemisms like passed away, and don't use any technical or medical jargon. You might say something like, I'm sorry to tell you that John became very unwell and died earlier today. I'm so sorry to give you this news over the phone. After you've told the person that the resident has died, stop for a few seconds to allow the person to take in what you've said. Listen for reactions to gauge when they're ready for more information. Remember that pauses are important, as you can't see the other person's reaction to what you're saying. Step 5 is about managing the emotional impact of the news. Do what you can to support the person. People's reaction will vary. They may cry, shout, or go quiet. Just stay calmly on the line and don't feel you have to fill the silences. You might say something like, I understand this is very difficult for you to take in. Remember that distress may limit their capacity to absorb information. It is difficult to know how a person is reacting when you can't see them. It is possible they're trying to minimize their reaction because other people are in earshot. Use sounds and words like, take your time, I'm still here. This replaces eye contact or touch and confirms your presence. Remember that the relative may find it comforting to know who was with the loved one towards the end of their life. The next step is to establish if the resident was a grandparent or had important relationships with other children. If they were, ask for the names and approximate ages of the children. If the children are under 25, you'll need to discuss with the person how to inform those children. We'll go through this at the end. The last step is to make a plan. Explain what will happen next regarding death certification and personal possessions. Ask if there are any religious or cultural rites or rituals that need to be performed. Reassure them that they will not have to manage this alone. Direct them to the appropriate bereavement services and online resources. There has been a lot to take in. Is there anything you'd like me to repeat or explain? Repeat your name and which care home you are calling from. Once the call is over, update the resident's file and tell other staff that the next of kin have been told. These are emotionally exhausting conversations. Take a minute to check how you're feeling. Take a break, have a cup of tea, or talk with a colleague. If the resident had important relationships with children, such as grandchildren, you'll need to give the family guidance on telling the children of their death. These are daunting conversations, and people don't want to upset children, but children need to know what has happened. In lockdown situations, families will have very little privacy and preparation time, so it's important for you to help the person with simple steps to prepare themselves, practically and emotionally, for the conversation with their children. The document, How to Tell Children, covers these steps in more detail. Ask permission to email this to the family straight away and check for the best email address to use. Here's a summary of all the steps we've covered. On behalf of us all, thank you for your dedicated service in these difficult times.